Which blood pressure number is more important? Is it the systolic number or the diastolic number? This is a very good question, and I'm going to answer this in detail. First, before we do that, it's very important that you understand what these numbers actually represent. So the first number, let's just use the number 120/80 as a standard. The 120 represents when your heart actually beats and pumps blood through the blood vessels. And as the blood is going through the blood vessels hopefully are pliable enough that they can expand a little bit. But they don't expand entirely. There still needs to be some pressure so that there's a propulsion of blood to all the tissues of the body. When this happens, it's measured in millimeters of mercury. So a 120 millimeters of mercury represents the amount of pressure when the heart beats. The second number, let's do 80 here, is when the heart is not beating. The heart is actually filling up with blood in preparation to beat. And there's still blood in the blood vessels, there's just less pressure because the heart is not actively beating at that moment. When that number is shown, it's a smaller number than the systolic, but the diastolic, which is the second number, represents the amount of pressure in the artery when the heart is not beating. So in the history of medicine, they used to just ignore the systolic number, kind of a gee whiz, we're just watching it, because they knew that the first number often goes up as a person ages. But the second number, because it's representing your heart at rest, was thought to be the more accurate number, the most important number. So they used to be concerned more with the lower number, the diastolic, and if it got too high, above 90, they would medicate you, almost ignoring the systolic numbers. Well, today, guess which number is the most important? Just like in all things in medicine, things change. The correct answer, though, is not the systolic, it's both numbers, but for a particular reason. Both numbers represent different cardiovascular risks that are important to understand. So let's do the first one. If you have blood pressure that, let's say, is 160/78, the 160, that is not a good number to have. Here's what happens. When the systolic numbers are high, they call it systolic hypertension. Puts you at greater risk for a heart attack, a stroke, and kidney damage. Whereas the diastolic number, if that's high, let's say a person has 119/98, that's a condition where we call that diastolic hypertension. And in that particular case, then the higher risk of having an abdominal aortic aneurysm is significant. I had a brother-in-law that died of an aortic aneurysm, and it's no joke. There's no real treatment for that. Once the aneurysm bursts, you're dead in an instant, and there's no treatment for it after the blood vessel bursts. So if your diastolic hypertension is a problem, it's best to have an ultrasound of the abdomen to make